Hello, this is Dr. Ely Seda, and I'm going to be reviewing with you our typical nurse intake workflow from the point a patient's arrived at the front desk to the point that the patient is ready for the physician to enter the room and continue the note. So the nurse intake is done primarily by a medical assistant, can also be done by an RN. But the first thing we have to do is change the status from arrived to nurse. We do that under the detail screen right down here, and then you change the visit status from arrived to nurse. And you just find the nurse and click on it. So now we've changed the visit status. Now we have to go through the process. We go through, I like to start with the chief complaint. And many times you'll see a chief complaint of follow-up. Well, that's really not a good chief complaint. A chief complaint should be there for hypertension, there for chronic kidney disease, proteinuria, whatever the main problem is, which will be fairly obvious by reviewing the notes ahead of time or talking with the patient. So let's just change this chief complaint to proteinuria. They're here for proteinuria, and how about hypertension? Let's add those two into the chief complaints. And you could do it under one line, or you can kind of add a second line as hypertension if I wanted. So just wanted to give you both options here. So there we go. So the next there, and I'm going to show these buttons up here. This is the quickest way to go through it. So by opening up these tabs, now you can quickly go to the main tabs. You're going to be primarily working with these four tabs here. This is the allergy and medication tab. This is the chief complaint tab, which we're already open. This is the medication reconciliation. This is the vitals. Now there's one other area what we're going to be going through. Both this patient hub is one other, and this area where we have to do the preventative medicine right there. So those are the only tabs that the medical assistants are going to need to go through. But let's go through each one independently. So we've already opened up the chief complaint, updated that. There's no boxes here that needs to be checked for, completed this box, basically. Most of the others have that under vitals, the vitals reviewed, etc. If this is a transition of care patient, that is, they've come from another hospital, another provider, and they're transitioning their care to us, we have to click on this transition of care button and select that electronic medical records were received or not received, and add whatever necessary data that's available here to the note. In this case, this is a temporary demo patient, so there are no electronic medical records to be received. But transition of care is part of the nurse intake workflow. So the next area, we'll start with the first button here, is going to be allergies. The medical assistant will update the allergies, and from here they can verify existing allergies or add new allergies by clicking the add button. Let's say they're allergic to procardia. Let's go with structured here, and then let's say procardia. Okay, they're allergic to procardia. Click on that, add it to their list. It's there, and you can ask the patient, okay, what was your reaction? They had swelling. Not much of a reaction, but swelling. And we can update anything we want here. It's more of a side effect, not a true allergy. The medical assistant does not have to make that clinical decision, but if they're familiar with it and comfortable, they can add this type of allergy. And it's an active problem. So we got to check this. Allergies verified right there. Check. Make sure it's checked. If they had no allergies, you have to check the no known drug allergies, which you would automatically check that box. In our workflow, the medical assistants do not have to add medical history. In some sections, they do want the medical assistant to add medical history or update it. So we're gonna go to the next section. So we've done the A. We've already done the chief complaint here. Now the third one is medical reconciliation. Click on that one, and it's going to show you the list of medications. The question we do not want the nurses to ask is, have there been any changes to your medicine? That's a general question that should not be asked. We want them to ask individually, hey, are you still taking lisinopril 20 milligram twice a day? Yes, great. Click on T for taken, And if you ask them, are you taking Inspra? They say no. Well, click on no. They're not taken. In Procardia, they don't know the dose. Maybe we know the dose now. Hey, we didn't know the dose last time. Do you know your dose? They say yeah, so let's update their doses. And one tablet, they're taking 30 milligrams, one tablet daily. Great. We've just updated their medication, and they're taking it. Coreg, they're also taken. Now here's the letters. T for taken, N for not taken, D for discontinued, and U for unknown. We don't know. Now we don't want the medical assistants to click on discontinue. The doctors will click on discontinue. We want them just to click that they're not taking the medications. Now up here you have to click on verified. If it wasn't already clicked, you click on verified and you go from there. Now if you want, the patient says, I was on this medication, but I don't remember which one it was. You can click on this external history. It'll go to the scripts database and pull up records from the pharmacies, which is pretty cool. This patient does not have any. It's a fake patient, so there's no data. But that's one way of obtaining it, obtaining the records. Really nice way of getting the medications. So when you're done with this screen, you click verified. The medications have been verified. So we've done the first button. We've done the second complaint. We've done the third. The fourth now is the vitals. So we jump to the vital section. We go there, click on that. Now we're highlighted the current date, which is in our example 4/30/2019. If the checkbox on the pop-up is not done, you can just start typing in whatever you want to type in. 70 inches, and they are 130 pounds, etc. And it'll enter it. Now another way is, you don't know what 70. You don't know they're 70 inches. You click on the pop-up, click here, and ask them. They say, okay, I'm 5'2", whatever you want to put, 5'6". Here we go, and you can update that. You got to move it over. That is their new height. Okay, you could go to the next section by clicking next. Their weight's already in there, 130. Okay, let's go to the next section. BMI is done for you. Now let's calculate or enter their blood pressures, both systolic and diastolic. So 120, over 80. Great. Got to hit this arrow to move it into this box. Whatever's in here is what is going to store in the database. But let's say you did 2 blood pressures, okay, on the same arm, okay. So you can enter another blood pressure here, and then you move it over. Yay! Apply it. We're good to go. You can add more blood pressures. You have more vitals. In our section, we want to do minimal. 1 blood pressure if they're coming for a follow-up. If they're a new patient for hypertension, we want both arms to be checked and standing as well. We have the temperature. You can do heart rate, respiratory rate, etc. Those are very important vitals. And just check with your clinical manager to decide all the specific vitals that are necessary for each particular physician. So we've done with the vitals. We've done all of these 4 buttons. Our next category is going to be at this patient hub. So you go to the hub. Excuse me. You go to patient hub. Now you go to information, and we're going to update. You go to additional information. So in patient hub, information, additional information to update their pharmacy. We have to update the pharmacy ahead of the physician seeing the patient. If they have more than one pharmacy, you can add it. You can select which is their primary by that P. That's a checkbox right there. If you want to add another, just hit add. Go to CVS in Austin. There we go. There's a whole bunch of them. And they tell you what street it's on. Okay, it's on East Palmer. All right, there. It's added. You can select which one is the primary by just clicking on that. E implies it's an e-prescription enabled. M is a mail order, etc. So we have the pharmacies in here. Now there's one other area we need to also do ahead of time is the circle of care. We're going to have a circle of care with a group category of Circle of care can say ADC. All of our circles of care will start off with ADC, and then we're going to add physicians to the list of providers. So that's how it's done. Okay, so we have a ADC group, and in that ADC group is the names of the providers, and it will be all providers, not just ADC providers, outside providers, any providers that are linked to this patient are going to be under a group ADC. The other section, the other names will be for, we don't even really need it. It's all we need is one. We need one that's going to be ADC, and all of the providers will be in that one. So we've done the pharmacies, we've done circle of care. We're done with this section, so we're almost done. All right. Last but not least, let's go ahead and get out of this. Let's close and close here. So now we've added all this information to the patient, and there's just pretty much one other area that needs to be done, and it's under the preventative medicine. In preventative medicine, talk with your clinical managers. They'll tell you which ones are required. For our 65-year-old patients or greater, we're supposed to do the fall risk assessment. You just basically click on the fall risk assessment and ask questions. It's that straightforward, but let's click on it if I can. And you ask the date. Okay, it's going to default to today's date. You ask them if they have had 3 or more conditions, if they had falls in the last 3 months. There's just certain questions you will ask and update, or you say no risk factors. So click on that. We're good. Okay. Have they had any falls in the last year? And you would say no falls in the last year. You're done. And the only other thing after this, we've done the fall risk assessment. We're going to do, you go on the right side of the panel under templates. You should have 2 existing favorite templates that were already created for you. This is a macro template for their BMI. If their BMI is above normal or below normal, you select. In this case, our BMI is 20, and it's not pretty good here. So we're not going to need to make any changes. But let's say their BMI is above normal. We would click on the above normal. Click on that little arrow. It moves it over and adds it to the preventative medicine category here. So now when we're done with all of these, and there's one other area, is the social history. Can't forget the social history. We got to check their tobacco, if they are a never smoker or are they current smoker, and you can ask other questions that are pertinent in your section. We're interested in whether or not they've smoked and whether or not they're drinking. Caffeine is important too. So those are the 3 questions that we like to ask. And that's it. The nurse then says details, change check-in status to provider, ready to be seen. Exciting, isn't it? We're done. Thank you.